It's known to its supporters as just 3ml, a little name for a big idea that took the findings of a massive survey as a starting point to improve 3 million lives by using telehealth and telecare. And many patients have already benefited from the way Solutions for Health has put technology into their homes, allowing them to monitor their own health and helping to lighten the load on NHS specialists. Charlotte Hume has been to see how it works.
Managing conditions using telehealth and self-care can reduce the burden on the NHS. At this Berkshire hospital, the consultant sees a patient with gestational diabetes. Using a Solutions for Health monitoring device, she can give her doctors blood sugar readings from home. It's easy to use, quick and effective.
If the readings are normal, we will reassure you. If the readings are abnormal, we'll be alerted.
The patient doesn't need the internet or a computer. 4 times a day, her readings are sent wirelessly to a secure platform which she and her doctors see. Instead of fortnightly hospital visits with a paper log, unsafe levels can be picked up quickly.
Gestational diabetes affects both the fetus and the mother. The diabetes can get worse and have all the complications. On the fetus, it has dangerous side effects. With this system, the advantage is I can intervene as and when required. I can log on to the results online and see whether the woman is adequately controlled or she needs some further advice.
The data is stored securely and advice can be given as a secure video chat consultation.
Telehealth will help with immediate readings from the doctor, will reassure me when I have high blood sugar episodes. I won't have to phone and try to make an appointment, and also it'll be much more helpful being able to deal with it from home.
They combine expertise and innovation in telehealth with a deep understanding of the patient community.
We're a healthcare company that focuses on reaching out to sections of the population that are hardly reached. We've got a real passion for driving and reducing health inequality. If you can provide people with the right tools and the right skills to better self-manage, you'll get 2 big outcomes: better health for the individual and lower burden on the NHS.
Whether it's for smoking cessation or asthma monitoring, telehealthcare solutions enable patients to be able to access advice through a platform in their own language and at a time that suits them.
One of the things that's really impressed me about Solutions for Health's approach has been that they will always start to look at things from the patient's perspective. So, for example, while traditional services offering smoking cessation used to be very clinically based, sitting in doctors' surgeries and so on, they were a true outreach service that started to set up in shopping centres and sort of community groups and where people were going anyway. It was making it easy for the patients.
They deliver innovation, quality and cost-effective solutions to the NHS through payment by result.
The key is to identifying the patients that need it, that are likely to use it, where it's going to cause some sort of behavioural change. They might not visit their doctor so often, they might not rely on going to A&E so often, they might not require a home visit so often. And if we were to collect all of those savings together, then that is more money then to invest in better quality of care for patients who really need it.
If you look at heart failure patients, they can deteriorate out of hospital at home with increase in fluid retention, increase in breathlessness, and there are some parameters, for example, heart rate, their weight, their urine output, their blood pressures, their oxygen levels, and that can be done out of hospital as long as it's transmitted to the health professional. We could troubleshoot and say extra water tablet or get into hospital now. So I think it can work in a way that will preempt, prevent and monitor.
We're actually able to support a great many more patients than we would otherwise have supported.
Solutions for Health, saving the NHS time, money and lives.